Okay, hi. So gonna do my first official post or whatever. Um, I'm just gonna start off by saying, most of y'all know what I've been through already. You kind of know what's going on already, and you have a good idea. But for those who don't, when I was 19, I was diagnosed with Barrett's esophagus. Um, it it was like constant heartburn, always having ulcers, in and out of the hospital, like couldn't eat normal stuff for a long time. Um, I'm Italian, couldn't eat pizza, um, couldn't eat, well, they told me not to eat spaghetti, but that didn't happen. Um, so after 5 years of not really exactly knowing what's causing it, Barrett's esophagus is usually diagnosed at age 50, and in men, it's very, very rare to see it in a 19-year-old female. So most of my doctors were pretty shocked, and a lot of the doctors in my area, like Webster and stuff like that, didn't really know what to do with it. So I went to a doctor, Dr. Brad Snyder, in Bel Air. He's at the UT Physicians Hospital. He did a upper endoscopy scope on me. That was my 11th one in 5 years, and found out that I was born without a reflux barrier. So normally you have like a small like area at your stomach that'll close off, so that way after you eat it'll close off, so stomach acid and stuff doesn't back up. I was born without that. So they went in and did a surgery called a TIF procedure, transoral incisionless fundoplication, and it was all laparoscopic. It was a day surgery, and he basically created me a reflux barrier. And ever since then, I've barely had any heartburn at all. I've been completely off all of my stomach meds since then, and that was in 2014. Um, it was probably one of the best surgeries I've ever had in my life. It completely changed my life. Um, when I was 23, so before my stomach surgery, um, I started having a lot of ovary issues, ovary pain. My periods and everything were all always really heavy, really just out of sync, out of order. Um, and I had a big old cyst that popped up on my ovary, and my doctor did surgery, and she found out that I have endometriosis. And that basically means that tissue that's like the uterus tissue, the uterine lining, grows outside of the uterus in places that it's not supposed to be. They gauged mine and staged it, and they said that mine is stage 3. There's 4 stages. One being hardly any endo at all, the very beginning of it, 4 being the worst. Um, Mine was a 3. It was on my bladder, it was on my bowels, um, it was all over my uterus and my ovaries, of course, but yeah, so it was kind of everywhere. And they also diagnosed me with PCOS, or polycystic ovarian syndrome. That's actually very, very common. A lot of girls have it. Mostly it just causes cysts, and it kind of just throws your periods all crazy. When you have endo with that, it endo is a hormone driven disease. So your body naturally makes hormones. There is no cure for endometriosis. No matter what anybody tells you, there is no cure. Um, a hysterectomy is not a cure, because even if you remove the ovaries, which are the main thing that produces hormones in women, it you still have other parts of your body that produce hormones, like your adrenal glands on your kidney, your pituitary gland in your brain. They all make hormones. So there's no way to take all of those out and have absolutely zero hormones in your body. A lot of people will say that birth control helps with endometriosis. Yes, it helps with the symptoms sometimes. Like, it can help your pain and can help your periods be more regular, stuff like that. But most birth controls, and I haven't found one yet, or been told of one yet, I'll put it that way, that doesn't have hormones in it. And endo's a hormone driven disease. So if you're taking a medication that has hormones in it, you're basically giving Miracle Grow to your endo. I've also had a blood clot in my lung as a complication from back-to-back surgery. So because of that, I'm not allowed to have birth control either. And it just never worked for me. It always made me sick, and it's one of those things that's not for me. So, yeah. Even things like melatonin that you take for sleep is a hormone. So you have to really be careful about what you put into your body when you have endometriosis. Anything with hormones is going to feed your endo, and it will grow and it will spread. I had a 2-hour phone consult with a specialist up by Dallas in a town called Denton, and he told me basically the ins and outs of endometriosis, and I'll keep it brief on here. But he said that you have estrogen and progesterone, and both of those are hormones in the body. Sometimes they can figure out which form of endo that you have, whether it's estrogen or progesterone, but some forms have both. And if you just have endo that is estrogen, then you can take a birth control that's progesterone based that doesn't have estrogen, and it will benefit you. Like if you're not trying to have kids. Another thing, endo does cause infertility. At 23, I was told that IVF would be my only option for children. And in 2015, I had to have my left ovary removed. I had a massive cyst that appeared. It was 10 centimeters, the size of a grapefruit. So, yeah, they couldn't save my ovary. It had completely engulfed it and twisted it, causing a torsion. So they had to remove it. Another thing with endo, though, is that most people don't realize is that it's not just bad periods. It's not just like cramps and stuff like that. My face is completely broken out right now. That is because of my endometriosis. Because it does mess your hormones all up, I'm basically stuck in puberty as far as my hormones go. They're always out of whack. I've tried any and every over-the-counter medication that I can think of for my face, and I've had no luck. My doctor started me on this, which is clindamycin gel for your face. It helped a little bit at first, but then it kind of stopped working, as you can see. So recently, she put me on this tretinoin cream, and it is like a spot treatment for my acne. So we're giving that a shot. I started it last Thursday. I'm hoping it helps because this, like, I'm broken out all under my chin here, all over my chest. Yeah, it's not fun because when I was in high school and when I was young, like, I had perfect skin. Like, I never had acne in high school. Like, when I was going through puberty and stuff like that, I never had acne. When I turned 23 and my endo started getting worse and they started realizing that this is what's causing it, that's when my face started getting really, really bad. And I don't even wear a lot of makeup. Like, my face breathes 90% of the time. Like, I never, hardly ever wear makeup. But, so that's what we're starting now. That's where I'm at. I'm waiting to see another specialist in Houston. So hopefully we'll get some good news there. About 4 months before they removed my ovary, I was in the hospital, and I thought I was having some stomach issues again from my surgery. Turns out it was okay. But during a CT scan, they accidentally found what's called renal nutcracker syndrome, meaning my abdominal aorta and my superior mesenteric artery, which is the artery that basically feeds all the blood to your intestines. Your left renal vein, it's like this in your body, and your left renal vein goes between it. Well, these two arteries pinch off that left renal vein and it backs up blood into my left kidney. So over time, it damages the kidney, it scars it, it causes like hypertension of the kidney. I get kidney stones a lot. I get infections a lot. And the problem with it is when you get like a basic urinary tract infection, for example. Most people, you drink water, you take your antibiotic, and it's gone in a few days. With the nutcracker syndrome, my kidney can't filter out stuff like it's supposed to. So when an infection gets in there, it doesn't know how to filter it out. So I end up on 3, 4 different home antibiotics, battling this infection for months, and sometimes it'll turn into a more serious infection called pyelonephritis, meaning it's just a very, very dangerous infection of the kidney that causes scarring every time you get it. It causes damage to the kidney. And 90% of the time, 95% of the time actually, they will admit you and do IV antibiotics for it. The last time I had it and it was bad, I spent 8 days in the hospital on IV antibiotics before it was finally gone. So that was a lot of fun. Not really. But that is something that they think I was born with. It's also very rare. There's only about 5,000 documented cases of it in like literature in the United States. None of the doctors down in this area know what to do with it. I've gone to vascular surgeons, I've gone to nephrologists to see what my options are, and most of them say, well, we can do this surgery or that surgery, but I've never done it before. And I'm like, okay, if you've never done this surgery, sorry, you're not going to try it on me. They've even suggested a surgery to me, actually multiple doctors have, that has an 80% mortality rate on the table, meaning there's an 80% chance you will die during surgery on the operating table. Again, no thank you. I'm not a gambler, don't like those odds. So that's pretty much just like where I'm at now, what's going on with everything. My stomach issues are pretty much, I don't have to deal with those anymore, thank God. So currently it's mostly just my endometriosis, which gives me problems every day, to some extent, and my kidney issues, which I can be fine one minute and then the next day I'm hurting really, really bad and don't even want to get out of bed. So this is just like a basic opening video. I will update more in the future. So for now, I just wanted to kind of let y'all know what's going on and kind of what it's been through. And I'm always happy to answer any questions. I'm always happy to educate to the best that I can. I'm by no means an expert. I don't claim to be or anything like that, but to me this is something that's really impacted my life, and if I can help somebody, then I'm okay with that. So I can take something good out of all of this mess and maybe help somebody else so they can get ahead of things before it gets bad, because I never knew about any of this before I had my diagnosis. I was an active young adult forever, and now, I mean, if you know me, you know I don't like getting out, I don't like doing anything, I don't really have energy to do anything, just trying to make it through school, and just try to have a normal life the best that I can with what I have. So yeah, if y'all have any questions, if there's anything you want to know, if you want to know more, don't be afraid to ask. I mean, you're not going to hurt my feelings. I mean, I don't mind sharing my story. That's why I started this.